Who am I? I am one of the 2,500 OTs who work in the hospital setting. I'm an OT, a student, instructor, and lymphedema therapist. I might be just a staff OT in the hospital, but my lens is influenced by the different roles I play. I see myself as part of a dynamic system. I have my personal desire for mastery. My environment interacts with the patient's environment as we move within the bigger environment of the hospital organization. All three of us is bound by the even bigger environment of society. Let us look at this big context. The Western culture values independence. Health and well-being is tied to the ability to control the environment to meet one's needs and participate in society. Disability is defined as the opposite. Complex business models influence healthcare. It focuses on reimbursement, productivity, and economic sustainability. These have the biggest impact in my work. It affects use of time, space, and technology. Context at a social level may seem too big and overwhelming for a single OT. Healthcare policies are created by a larger governing body. The needs of the profession are communicated through the AOTA. Occupational therapists must unite to influence this context. Now let's look at the community. The hospital is owned by a nationwide company established by two physicians, so we have a medical model. It still follows the business model. Reimbursement is still the focus, and so is customer satisfaction, FIM scores, and shorter length of stay. Florida has the highest population of people 65 and older. My hospital is located in St. Pete. This area is popular among retirees and baby boomers. Our hospital is also considered LGBT friendly. Once again, I am part of this big organization. I do not have direct control over these since it is controlled by corporate and managers of the city. But we have the state association to represent us. Now let's look at the rehab unit. Our unit is assigned one nurse for every 4 patients. They rely on OTs to perform ADLs, so OTs are pressed to focus on ADLs at both the community and proximal context level. But this has not been a problem so far because it's their goal anyway. Time is now a combination of clock time and event time. Clock time is still evident in therapy time and length of stay. Event time involves the patient's past, present, future, their routines, and rhythm.
Created using Powtoon.